Maybe you've seen them on television or in the newspapers, stories about problems in the nursing profession. According to national news reports, thousands of patients in hospitals and other healthcare facilities around the country have died over the past 5 years due to system errors blamed on nurses. But it's really a little more complicated than that. You see, many facilities, pressured to cut costs, have been reducing the number of nurses on duty to dangerously low levels, especially in areas where nurses must care for seriously or critically ill patients. Nurses also say they are so overwhelmed by the numbers of patients they must care for that they're not being adequately trained to use new devices that they are responsible for. Devices which, if not operated properly, can kill rather than cure. Some facilities have even been assigning essential nursing duties to aides and other employees who are unlicensed, unregulated, and thoroughly unprepared for their expanded role. To add to the problem, nurses are often required to work mandatory overtime, shifts that can run 16 hours, meaning the few nurses who are on duty may be so exhausted that patient safety is jeopardized. Phrases like "within industry norms" are used to defend these reduced staffing levels. But the truth is, many areas staffed entirely by registered nurses just 5 years ago now depend heavily on lesser trained and lower paid personnel. The low staffing levels, overwhelming workload, and other conditions also discourage many nurses from working at the patient bedside, which only makes matters worse. Healthcare administrators point to a so-called shortage of nurses, but fail to acknowledge their own role in creating the problem. So what does all this mean to you? Nothing really, unless you or someone you love is a patient in a hospital or other healthcare facility and needs a nurse. The Ohio Nurses Association is asking the Ohio General Assembly to pass a law that would ban mandatory overtime and ensure that nursing staffing levels are sufficient to provide the amount of care patients need depending on their condition. Nurses have been there when we needed them. Now they're pushing the button, and it's our turn to respond.